colorful characters and pairs it up with the language of education. Have any of you seen any of these acronyms?
Yes, ma'am.
Yes. It's like you go to an IEP meeting or you meet with a school administrator, you are speaking a totally different language. And it's very important for you to become familiar with that. So today we're just going to review a few things, and if we have time at the end of the presentation, I'd like to review some of these acronyms that we're going to cover in the presentation today. Alrighty, the first thing I want to show you is the Centers for Disease Control and Prevention whole school, whole community, and whole child model. This is the new model that is replacing the coordinated school health model, and the reason that it's important is that over here you see health services, and health services are a very important part of school health for a lot of these kids. Now, the Supreme Court determined what school health services entails years ago, and it is any service that does not require the expertise of a physician. So you can't have a school administrator say, oh, we're not going to do that for your child at school because we have never done that before. If it does not require the expertise of a physician on site, that falls within the realm of school health services. If you look back at legislation that has impacted school health, it started back in 1965 with the Elementary and Secondary Education Act. Now, the Elementary and Secondary Education Act has been reauthorized over many years. Have you heard of No Child Left Behind? That is a reauthorization of this act, and we currently have ESSA, which is Every Student Succeeds Act. So periodically we will have this reauthorized. They'll change the name of it, put their own brand on it, but it started back in 1965. Of importance to us today is the 1973 Rehabilitation Act. Now, have you heard of Section 504? Yes. There are over 700 sections in this act, but Section 504 is the one that impacts our students the most. In 1975, we saw the Education for All Handicapped Children Act, and this has subsequently become the Individuals with Disabilities in Education Act. Prior to 1975, there were over 1 million children in the United States who did not attend school because they had significant disabilities and their needs could not be met in the school setting. 1990, we saw the Americans with Disabilities Act. What we need to do and to comply with these laws is provide a free and appropriate public education, which if you've been in a school meeting and you hear administrators talk about FAPE, that's what FAPE is, in the least restrictive environment. School is the least restrictive environment. The most restrictive environment for a child is homebound or hospital-bound education, to the greatest extent possible with their non-disabled peers. Now, in both the Individuals with Disability Act and Section 504, school districts are charged with what is called the child find responsibility. It is the responsibility of school districts to identify children both in the school setting and in the community between the ages of birth through 21 years who have disabilities so that plans can be developed to provide services to them to help them succeed. The reason that it starts at birth is because we know that when we identify these children very early on, we can implement interventions for them. And a lot of our kiddos who come through the child find process and then matriculate through preschool and elementary, we see them exiting the special education process in 3rd or 4th grade because we've done our job for them and we've met their needs. What are the reasons to trigger the child find responsibility? We may see a student that is demonstrating difficulties in the school setting. We have to figure out what is going on with that student and how can we put interventions in place to help them succeed. Who can trigger child find? Anybody in the community. When we talk about identifying children who are born with disabilities, frequently the social worker from the hospital will contact the local education agency or school district and inform them of a birth of a child who has a significant disability. That's how we trigger the child find responsibility at the age of birth, but then it continues on. We may receive a call from a community member who states, I don't know if you're aware of this child in the community. And then the school district sends out their child find team to meet, interview, put together a plan and interventions for this student. Section 504 or other intervention plans appears to need more of something. If we're in the school setting and we have a kiddo who already has an IEP plan or a 504, but they're still not succeeding, we need to go through that whole process again and make sure that the plan we develop is meeting their needs at that point in time. Now let's start out with Section 504. Remember, this started in 1973. So the Act specifically states that no otherwise qualified individual with a disability in the United States, as defined in Section 720, shall solely, by reason of her or his disability, be excluded from participation in, be denied the benefits of, or be subject to discrimination under any program or activity receiving federal financial assistance, or under any program or activity conducted by any executive agency or by the U.S. Postal Service. So Section 504 is very important. It does not apply just to students. It also applies to adults in the community. This is for any person in the United States who has a disability. Section 504's definition of a disability is broad and expansive. It is any physical or mental impairment that substantially limits one or more major life activity, or has record of such an impairment, or is regarded as having an impairment. So now we're going to look at a few specifics. So the law doesn't really stipulate who's invited or who is involved in a 504 meeting. And if you have a child who has a special education plan for instructional purposes and then a 504 plan for extracurricular activities, what you may find is the special education meeting is much more involved than the 504 meeting. And the reason for that is the participants are not specified in law. We do like to have people involved who have expertise related to the student's needs and accommodations. So for a special education meeting, you will have a lot of special education and regular education teachers involved, whereas maybe for the 504 meeting, you're going to have the school nurse and the coach for the after-school activity involved in that. The districts are charged with developing procedural safeguards. In other words, a school district develops the process that they follow for the 504 process, whereas with IDEA and special education, that process is defined by the law. There is a child find component for Section 504. Now, the one thing that's very important to note here is that episodic conditions in remission or mitigating factors cannot be factored in to the 504 decision. The condition must be considered when it is in full force. In other words, if you have a child who has had a surgery that repairs the Chiari, the school administrator can't say, oh, well, you've had surgery and you're cured now, you don't need a 504. You must consider that this child has that Chiari and what it would be like if they did not recover well from that surgery and had never had that surgery. Does that make sense? Yes?
So like with a POTS flare, is that addressing there? Like
exactly. You have to consider when the condition is in its full force. So a student who has POTS may have a treatment that they're responding favorably to. That doesn't mean that 504 goes away. Okay? We have to consider the disability when it's in full force. Alrighty, that's a great question. The time frame for Section 504 is not specified by law either. However, we generally follow the IDEA guidelines for that. So if we identify a student that has a disability, we like to have that 504 meeting within 60 days and make sure that we have that plan in place for the student. It's the responsibility of the local educational agency, that's the LEA, to identify students with disabilities. Okay? A 504 plan does not address educational instruction. It provides accommodations to level the playing field so that a child with a disability, a student with a disability, can access their education, can access their extracurricular activities. Alrighty, here's an example, a list of examples of 504 accommodations that you might normally see. We don't generally write 504 accommodation plans that have 25 accommodations. We like to keep it very specific and individualized to that student. We want to make sure that it is comprehensive for that student, but we don't want to, as I said earlier, write 25 because you're not going to need all 25. We want to find those accommodations that really target what that student needs. One that we typically have used in the district I worked in is referred to individual health care plan. And that is a wonderful way to allow a health plan to contribute and speak to the 504 process as well as the special education process. But we don't put or attach the plan to the 504 or IEP, because then if your child has a change in health status and we need to rewrite the health plan, it gives us that flexibility to do so without going through the entire process of a special education meeting, a reevaluation, or another 504 plan meeting. We always like for our kiddos to have access to trained and delegated staff who can help the school nurse, or if there is not a school nurse on site, who can identify early on when things are not going well for the child and can either communicate with the school nurse or call the parent and let them know that the child is not doing well that day. We always want to make sure that our kiddos have access to their rescue medications, access to a school nurse, specialized transportation services. 504 plans can provide access to specialized transportation. Remember, we're leveling the playing field so that child can access their education. Preferential seating whenever necessary. Extended times on tests or assignments. Reduced homework or classwork. Another thing that we may do is make sure that a child who maybe has mobility issues has a set of books at home and at school so that they can go back easily and access their information. Behavior management support. If your child has a 504 or an IEP plan and we're seeing behavioral changes, it's our responsibility to make sure that what we're not seeing is a manifestation of the disability before we discipline a child. We want to make sure that we're understanding what is going on with that unique individual and that we're correctly interpreting and responding. So if you have a child who has a sudden onset of a headache and goes into a rage because they have Chiari, we don't want to discipline that child for behavior. We want to make sure that we understand they need pain control. We need to call that parent, and we need to communicate with the physician that the child is having a significant change in their health status. All right? Adjusted class schedules or grading. I have, as a former district administrator, provided input into both 504s or IEPs when we have students with POTS. Some of those students miss significant amounts of school. And in the district I worked in, if they missed more than 10 days in a row, we were working to provide homebound instructional supports to make sure that they could continue to access their education and keep up with their peers in school. So it's very important that we meet our responsibilities to these children. Children who have visual difficulty may need verbal testing. So there are lots of different ways that we can provide accommodations to students and allow them to access their education. And it's very important to remember that it's individualized for that specific student. I was asked to put together some sample 504 plans a few years ago by an organization for students with Chiari, and I thought, well, it depends upon what their presenting symptoms are. There is no cut and dry list of accommodations that will fit every child. So that's why it's individualized and unique. Alrighty, now I want to move on to the Individuals with Disabilities in Education Act, and this is also known as IDEA. This definition of a disability is very restrictive. Now remember, 504 is broad and expansive. For special education, it's very restrictive. You must have what's called a qualifying disability, and we'll go over those on the next slide. An IEP, or an individual education program, provides educational services and accommodations for children with qualifying disabilities. There is also the child find component in this, And what is very distinct and different from IDEA as opposed to 504 is that there are multiple procedural safeguards written into the law to make sure that children are taken through the process appropriately. There are very distinct time frames from the time, and we'll go over the process in a few slides, from the time that a parent signs permission for evaluation until we have that meeting where we agree that there is a disability and develop a plan. We only have 60 days to get all of the evaluations completed and everything rolling. There should never be cost to the parent for an individual education program or an evaluation for this. So if your school is telling you that you need to go to the doctor and have another evaluation, and that is costing you or your insurance provider additional funds, that is incorrect. It is the responsibility of the school district, if they are requesting an external evaluation, to pay for that service, okay? There are very distinct time frames. It's a process that is strictly adhered to. And remember, this is educational. So we can consider the IEP bell to bell, from the start of the school day to the end of the school day. Well, what if your child goes on a field trip? An educational field trip, they will still have their accommodations for the IEP. If, however, they have extracurricular activities, that's where the 504 comes into play, okay? Moving on to the next slide. This is the list of the 14 qualifying disabilities. Now, there are a couple that would serve as a catch-all, and one in specific is other health impaired. I'm going to go on to that in the next slide. This is typically where we see our kiddos with POTS, Chiari, Ehlers-Danlos, dysautonomia. They fall into this category. Now, for Ehlers-Danlos, I've also seen students qualified under orthopedic impairment. So just those are the two that you would most likely see. And the definition is in OHI is pretty broad and expansive. It lists some disorders, but that is not all inclusive. Those are simply examples of what OHI could be. And if the condition causes them to have adverse educational outcomes, they may qualify as having an OHI disability within IDEA and qualify for a special education program. Alrighty, so what is the process that we go through with special education? As I said earlier, it's very specific. A student is identified, and that can happen in one of two ways. We could have a parent or someone in the community notify the educational agency, or people within the school could identify that that student has difficulty learning and trigger the child find component. We have to have parental consent to develop an IEP for a student. We cannot go through any testing with a child unless we have parental consent. If a parent does not consent and the child is really struggling, the school district has the option to file due process and involve an administrative law judge to make the decision and provide consent. And that is a very rare situation. We typically like to have a very strong relationship with our parent guardian and take them through the process with us and address any concerns they may have about having their child go through the special education process. But we do need consent. The student is evaluated, and then eligibility is decided. If the child qualifies under one of those 14 categories, we continue. We have an IEP meeting, and we have a big team of people that come together to develop the program for the child. We determine what the services are needed, what the goals are that we're going to monitor to make sure that they're succeeding, and then we implement the program. We review it annually, and the student is reevaluated every 3 years. And those are the minimum times that we reevaluate. So let's move on. So the IEP is always reviewed annually, and it can also be reviewed upon a parent request. So if you notice that your child is not succeeding in school, and you're seeing red flags at home that indicate that this program may not be working, you can reach out to the school and say, I have serious concerns. Can we meet and talk about this? We may need to have a reevaluation. Or perhaps you just had a meeting and they change services and it's not working for your child. So also, if we see a significant change in health status with a student, we can trigger a re-eval on that student and make sure that we're meeting their needs. An example of that would be a student who has their placement in the school setting but has a very challenging situation that they're facing. Maybe they've had a surgery that did not go well and they're not going to be able to come back to school for a while. We're going to want to have a reevaluation and look at the appropriate placement for that child. It may be that for a period of time they may need a more restrictive environment to promote their healing, but then also be able to access their education. If the student is demonstrating a lack of progress with their plan, we definitely want to reevaluate it. And a complete review is done every 3 years for continued determination of qualification under IDEA and to make sure that the child has the appropriate services. Now, who's on the IEP team? There are a lot of people involved. We like to have the student available when it's appropriate. In other words, is that child old enough to be there and contribute? And we tend to see that more as we go into 4th and 5th grade and beyond, that the student is involved. We definitely want the parent and guardian. We are required to have a regular education teacher, in other words, who is that child's homeroom teacher, as well as a special education teacher on the team. We always have a district administrator or what we call a local educational agency representative. This is someone who can determine whether or not we have the resources to provide these services and how we're going to allocate resources to meet that child's needs. I frequently attended IEP meetings and 504 meetings when we had to determine a placement for a child. In other words, could our district provide the services for that child in the school setting, or did we need an out-of-district placement to make sure that we could effectively meet their needs? And that requires a significant allocation of resources. We also want to have people who have knowledge and expertise about the child. And I have a slide about doctors coming up, but if your doctor has important information that contributes to the needs of your child in the school setting, they can, with the parent permission, call in and be a part of that IEP meeting. They can attend with parent permission. We also need to have people who can appropriately interpret evaluation results. So you would not want your school social worker or psych giving the school nurse report. You wouldn't want the school nurse giving the speech language pathology report. You want to have the people who are experts in those areas present, who are able to speak to the child's strengths and needs. Transition services, if applicable. Now, whenever we have a child changing levels, in other words, going from elementary to middle to high school to college, we want to have people who can facilitate that transition. So when we have an elementary student going to middle school, we'll have the elementary team with a representative from the middle school team to make sure that when that child matriculates, their services are available and their needs are being met. That's a big team. How many of you have asked your physician to write a prescription for an IEP or a 504? Please don't do that. A healthcare provider may not prescribe an IEP or a 504 because it is a very specific legal process and it involves a team and a team decision. We want to be very careful about that. Your physician or healthcare provider may recommend an evaluation. They may provide documentation supporting the need for an evaluation. They may recommend accommodations that need to be put in place for your child to succeed at school. And they may also attend a meeting to support and advocate for the needs of your child with the parent permission. Okay? So if your doctor pulls out a prescription pad, and I bring this up because I've seen a few, I wish I had, kind of framed some of them. Please give this student an IEP. We can't do that. Okay, but we can evaluate your student and we can make sure that we're putting the appropriate plan in place to meet their needs in the school setting. What happens if a parent doesn't agree with the plan that they put in place? Well, you have rights. You are a very important member of that team. And if you are going through a meeting where you do not agree, you should make your objections known during that meeting. I've sat through meetings with parents, and I totally understand. They're sitting there and they're saying, I do not agree with this plan. I do not agree with this plan. We also note that in the plan that the parent did not agree. If after the meeting you still do not agree, you can request mediation. And that is a voluntary process where you have two different people coming together with a mediator, and you discuss in a civilized manner, what one side saw as the child's strengths and needs, and then what the other side saw as the child's strengths and needs, and try to find a common ground and meet. Now, if that doesn't work, a parent or a guardian may file a state complaint with their local Department of Education. So in Colorado, it's the Colorado Department of Education that you would file your state complaint with. They have a team of people who then investigate the claim and make a judgment. If the parent is not satisfied with that, they can file due process complaint. The due process complaint would involve an administrative law judge reviewing all of the documentation and taking testimony from both sides, and then that judge's decision is final, and that is how they would proceed. If you continue to have complaints, and we're going in hierarchy, we hardly ever make it past the due process complaint, okay? We usually can solve a problem early on. Then you can go to the Office of Special Education and Rehabilitative Services, and that's one of the acronyms we saw on that first page. That's called OSERS. Now, 504 complaint, if you have a concern about that, that's a very different process. School districts are charged with developing a procedural process to handle complaints, so it would be different from school district to school district. But the one agency charged by the federal government to follow up on 504 complaints is the Office of Civil Rights. And the Office of Civil Rights, their charge is to eliminate discrimination on the basis of disability against students with disabilities, okay? OCR enforces Section 504. OCR investigates and issues remedies. So if we have an OCR complaint and the Office of Civil Rights comes back and says, you as a school district need to do this, we are doing that. That is the final word. And in egregious situations where the violations are severe and consistent, OCR can determine that that agency should no longer receive federal funds. That doesn't happen very often, because usually when OCR says you need to do something, agencies comply, okay? Alrighty, let's move on to the individual health care plan. How many of you have heard of this before? Yes? No? So an individual health care plan is a plan that is written by the school nurse. And remember, if your child has an accommodation in their IEP or 504 that says refer to individual health care plan, this is a document that we have to have in place. The reason that we do it that way, and refer to the IHP as an accommodation is that it gives us the flexibility to be responsive to the child's health care status. And if the child's health care status changes and they need more interventions medically, or if they improve and need less, we can change that IHP and have it be responsive to the needs of that child. Alrighty, so who is responsible for developing the IHP? It's the school nurse. I was fortunate to be director of health services in a school district that had a nurse in every building. So I had 70 school nurses that really got to know their kids in the school setting and worked well with parents to develop plans to keep kids safe at school. Not every district is that fortunate. There are some states on the East Coast, and I think Massachusetts is one of them, that has a mandate for student-to-school nurse ratios. So on the eastern side of the U.S., we tend to see a higher number of school nurses. I know New Jersey also has a very strong presence with school nurses. But as we go further west and we become rural and frontier states, we tend to have what is called the nurse consultant model. And that is where a nurse covers 4 to 5 schools. The ratio may be 1 nurse to 2 to 5,000 students. So that's a very different situation, and it presents challenges for our students with disabilities, as well as our parents who have these kids in the school setting. Whenever possible, it's important to get to know your school nurse or your school nurse consultant so that you can work with them to develop the individual healthcare plan and provide them with the information to meet the child's needs in the school setting. How does the school nurse determine if they need an IHP? Well, if you answer yes to any one of these questions, your child needs an individual healthcare plan, okay? Do we need special training of school personnel? Do we have to have people who can identify early on when a child is decompensating and maybe either take them to the school nurse or, under the training and delegation of a school nurse, initiate a response to what the child is experiencing? An example I'll give you that is not always tied to Chiari and the comorbid conditions, but sometimes we do see students with seizure disorders. We want to make sure that we have trained and delegated staff on site who can respond appropriately when a child is having a seizure, provide that immediate first aid, administer rescue medications, and initiate a 911 call. Okay? That's very important for a child to have. Do they need a modification of the school environment? I was involved in an IEP meeting where we actually changed the placement of a child's school because they needed to be in a very temperature-controlled environment. And their home school, the special education classroom, had a lot of windows facing west, and in Colorado that means hot. And so we couldn't have the child in that situation. We transferred them to a local elementary school where the environment could be more closely monitored and respond to that child's needs. So these are just examples of all the things that your school considers for your child. Do they need added safety measures? Do they need measures to relieve pain? Once again, let's get that school nurse involved. Let's make sure that we have a plan in place. Another example I'll give you is I had a lot of kiddos who had migraine action plans. In other words, we had a really strong neurology department that we worked with for kids with migraines. We developed these plans that were unique to that individual child. The majority of plans called for immediate hydration, administration of a pain-relieving substance, and then also rest in the school nurse's office. But we wanted to make sure that we had those plans in place. Do they need assistance with self-care needs? Some of our students who are in wheelchairs need assistance, especially when they're very young, with transfers in the bathroom, and they need a little extra assistance in making sure that they are safe while they're using the bathroom. So something like that would be written in. Rehab measures, do we need to work with our school PT, OT, and make sure that they understand how to transfer and keep the child safe? Those are things that are written into the healthcare plan. Treatments and other special procedures. We had a significant number of kiddos in our district that had G-tubes in their tummy because they had dysphagia. They couldn't always swallow. It wasn't safe for them. So we fed them through their G-tube in their stomach. Because I had 70 school nurses on site, we were able to train some of the nurses to respond in their own little area and replace a G-tube if it came out. Because that can be a big crisis for a family. If that hole starts to close, that's a whole nother medical procedure for a child. So in our district, that was an emergency response plan, and we had to have physician's orders and specialized training to do that. But remember, this is something that does not require the expertise of a physician. And so it is the responsibility of the school district. Let's see, special diet. We've had a lot of kids on a lot of special diets. And there is a special form that parents fill out that provide dietary accommodations in the school setting, respective to that child's needs. So we just have to be aware of all of these things. And then whenever we have medication orders, we want to have an individual healthcare plan on a kiddo. This is the process. And now I'm going to tell you a funny story. So sometimes the school nurse identifies that there is a health disparity, and the parent is like, well, they've always done that. Well, you know, that is the value of having a school nurse. And sometimes parents have a child that they know they have a disorder, but gosh, they've always had it, so they don't really get into the habit of telling everybody all the time. We found out in December of last year that we had a student with adrenal insufficiency that required an emergency injection if they were injured or had a fever. Well, that kid had been with us for over a year. The parent just never informed us. So we have to work together. We have to communicate with each other and make sure that we're sharing information with each other to keep our kids safe when they're at school. The school nurse does an assessment of the health condition. They create and authorize the student IHP, and that includes having the parent sign off on that. And if there are medications or prescribed orders, it includes having the physician sign off on it. Then we implement the plan and evaluate the outcomes. So, I talked about sharing information. How many of you are familiar with FERPA? Yeah. That's the Family Educational Rights to Privacy Act. So whenever a parent brings information about a child's medical condition to the school setting, it doesn't fall under HIPAA. Once that record is transferred to the educational agency, it becomes a record under FERPA. And under FERPA, school personnel share information, including health information, on what we call a need-to-know basis. There is no intent to violate a child's confidentiality, but it's very important for a teacher in one classroom who is transferring your child to a teacher in another classroom for both of those teachers to be aware if a child has a significant health condition that could manifest itself in the classroom setting, okay? There are health and safety exceptions under FERPA as well that allow schools to share information. Say a child is injured in the school setting and we're calling 911, we can call and transfer information to the paramedic or to the hospital or to the child's healthcare provider during that emergency. That's just one example. Another example is when a healthcare provider sends us a letter out at the parent request and outlines the child's health condition and says, please call me if you have any other questions so that I can help you with this child. We can call as well to that provider. Alrighty. How do you promote your child's success at school? I think the number one thing to recognize is that as parents and guardians, you're your child's greatest advocate. You know your child best, and you live with it. For all parents whose children have disabilities, it's a 24/7 job, keeping up with that. And it's important for you to go and develop relationships with key school personnel, and I keep mentioning your school nurse. When your child has a health-related disability, your school nurse is your number one cheerleader, your biggest advocate for your child in the school setting, and they can do so many things to keep your child healthy, safe, and ready to learn. If your child has a change in their health status, communicate in a timely manner. I used to take phone calls from my parents of our special ed kids first thing in the morning. Sometimes they just wanted to share with me that, they didn't sleep well last night, they may not be at their best. I would go to the SPED teacher and say, hey, if this child needs to come to the clinic and take a little rest today, let's work together on this so we can help them make it through the day. If you need additional assistance, you can reach out to your local educational agency and they can help you locate an advocate within your community. Not all of our parents feel comfortable advocating at an IEP meeting for their child. And they can certainly bring in an advocate. That is someone that can help speak to the child's health condition. And they are more than welcome at meetings where we're putting plans together for kids. Engage in being involved in your child's education and the school community. We want our parents there. We want our parents involved, and we want to work together with you. We have students for 6-7 hours a day. That's more than half of a child's waking time. And we want to work with you to promote their success. And we know that kids who are not healthy and whose health needs are not met in the school setting cannot succeed at a high level. So I'm going to go back to that first slide. Does everybody remember all of these acronyms? Some of them are really easy. We know what HIPAA is. FAPE, Free and Appropriate Public Education. OHI, Other Health Impaired. That's one of the qualifying disability categories under IDEA, which is the Individuals with Disabilities in Education Act. And then we talked about the Least Restrictive Environment, or LRE, 504, FERPA, Education Privacy Rights, OCR, the Office of Civil Rights, OSHRS, the Office of Special Education and Rehabilitation Services, Individual Healthcare Plans, Americans with Disabilities Act, and IEP, people call it Individual Education Plan. That's fine, we'll roll with that, but it's Individual Education Program. Lots of things available to help kids succeed at school. You and your doctors do amazing things for your kids. Make sure that you get the school involved to facilitate their continued success and recovery. Do you guys have any questions? Yes?
How far up in the education system does this go? Does this stop there?
Oh, that's a great question. That is a great question. So I'm going to go to the child find component for that. That is birth through age 21 years. Okay?